is a particularly poignant time to discuss these issues, as today is International Opioid Overdose Awareness Day. So I'm going to go ahead and start my presentation. And I definitely want to make sure that you know that I am happy to answer any questions for you after I go through a few slides, just really highlighting kind of where we're at within the opioid crisis, and then what we as community individuals, healthcare professionals, and really just messengers of information within our social groups can do to help mitigate some of the challenges that those who suffer from addiction may benefit from. So really, when we say shining a light on opioid overdose, I think a lot of people have been sort of thrust into this world and learning more about addiction medicine because of the very prominent social aspect of the jury trial and the cases related to the Sackler family. So they are the family that own Purdue Pharma. And so they're one of the largest of the settlements when it comes to, having to take direct responsibility as a pharmaceutical manufacturer for the opioid epidemic and for the opioid crisis, because they were one of the first companies to actively market opioids directly to physician groups and to consumers, knowing full well the addictive properties of these medications, and that certain individuals, even with as little as one dose, that they could become addicted to these medications. So before we get started into some of the details behind, what is sort of the landscape of the epidemic as it relates right now and sort of what we can do to help, I wanted to first just define what an opioid is, because we talk about what an opioid crisis is and all these things, but I think most people are probably familiar with the pain pill itself. But there's a lot of other things that this encompasses when we say opioid, because it's a class of medications. And this class of medication includes both legal and illegal substances, as well as synthetic substances. So, it's a whole class of meds. And so it's not just that pill that I think necessarily people think of. It's illegal drugs that are injected, snorted, inhaled. There are also, synthetic opioids, which is a huge challenge we have right now within this crisis, because a lot of the product, in particular heroin that's on the market, has been laced with fentanyl and different types of fentanyl, which has so much more potency in it. And so somebody who maybe is a regular, user of these products may think that they can use the same amount, not knowing that the product has fentanyl in it, and then that's what causes them to overdose. So, so thinking about this not just from the physical pill, but also the synthetic opioids, which are things like fentanyl and other pain relievers that may have a combination of, say, an NSAID, like an ibuprofen or a Motrin, plus acetaminophen, which is another type of pain reliever that we see in things like Tylenol. So a lot of times you'll see them combined. So you'll see an opioid like oxycodone combined with a Tylenol to help with the pain relief. And so, we see this a lot. We see it being used post-procedure. So say you go in, you have a root canal or you have a dental procedure, and, we were seeing things that could have easily been treated with an over-the-counter pain reliever, and people were being prescribed these medications. And unfortunately, it was leading to them having trouble with addiction. We also know that if someone is hospitalized and they have to have a surgical procedure and they use things like morphine or codeine, those are things that someone could be exposed to just because they had a hospitalization, not realizing that those medications can be highly addictive. And so again, however people come to have this challenge in life, I really want you to understand that it could take just as little as one dose based on our brain chemistry. So some people are exposed and do not become addicted, and some other people are exposed and become addicted right away. And so that brain chemistry and that realization of that occurring, I think, is really important when we think about when we have care and compassion for individuals who suffer from substance use disorder, because it is a disease and it requires treatment. It's not something that you can wish away. It's not something that you can just stop doing because we told you to stop it. There is a lot of other factors going on. Also, the fact that we see oftentimes with marginalized communities, including our BIPOC community, that we're seeing that some of these drugs are being taken without the knowledge of what the full impact of them is, as well as that because those are historically marginalized communities, oftentimes these medications are used to self-medicate because of the stress of, poverty, lack of family support. We see this a lot in the LGBTQIA plus community, that they are more prone to have challenges with substance use. So just wanted to start off with that as sort of a foundation before we get into some of the details. So today is a very important day. Today is the International Opioid Overdose Awareness Day. And so the key for this is that obviously we have awareness days throughout the year for health-related conditions. But really today is it's an opportunity to recognize those who go unseen. And this is part of the theme for this year. And they're using the hashtag We See You and End Overdose. And I think it's really important to know that we want to honor the people who are altered by overdose, whether that is the person themselves that survives the overdose, or if it is the family member that is left behind after that person has passed away. And so that grieving process, which by the way, just this week was National Grieving Awareness Day, and sort of the impact of how grief and lasting grief impacts our lives, I think is really important. And it's not just the family member and the loved one, but also the healthcare professional that helps with that situation. So as healthcare professionals, we want there to be a successful outcome. And so when we know someone who has struggled with substance use challenges and they've been on a good track, and unfortunately they've relapsed, and then that person ends up with an overdose, it can be really, disheartening, because, that person really came a long way. And then for them to, lose their life because they wanted to use for whatever reason, there was a stressor, there was a trigger, something happened, and they needed to, calm themselves, or they felt that using was the only option. So, we know that the support system and the services that we can provide, care, compassion, our first responders, being there, even like our library systems, we've seen people, overdose in libraries, and now our librarians are having to, learn how to use Narcan and reversal agents in order to help people in crisis. So again, today is an important day. We honor, those who care for individuals who have challenges with substance use, and really want to make sure that those people who are on the other side of those suffering from addiction are being recognized as well. So I did want to just talk a little bit about equity and equality. So one of the things that we've realized during this opioid crisis is that it's not hitting everyone equally, and access to services are not equally distributed. So the concept of equality versus equity, I think it's always a good idea to really kind of talk about this in a way that is easily understood. And so we know when all things are equal, that's one thing, right? So everybody having a bicycle is great, but if not everybody can access that bicycle for whatever reason, because of their lived experience, because of their own individual needs, that's not equitable. And really the concept of equity is about things being just, not only that they are equal. And so as you can see at the bottom image, everyone has been accommodated, and everyone's experience and their ability is being accounted for. And so when we think about offering services around opioid overdose and opioid addiction services, we need to be thinking about this in a means that is equitable, not just equal. So one of the things that has been a bit of a concern with the money that is being put into opioid and overdose prevention work is that it's not equally being distributed and equitably being distributed to Black and Brown communities because of the stigma around substance use disorder in those communities and lack of access to addiction medicine specialists. So I did want to just point this out because this is something that the AMA, which is the American Medical Association, is specifically trying to address, as well as the CDC, when they came out with their statement a few years ago, specifically addressing racism, and that racism is considered to be a public health threat. So if we take a look at the trends, obviously starting back here in 1999, as far as overdoses, we have definitely seen a precipitous increase in the rate of overdoses and overdoses that have been associated with death. And this is really a few reasons why. So this only goes through 2021. I will tell you that this will likely be increased beyond that because we have seen more overdoses, particularly around fentanyl use in 2022 and then also this year as well. So when we look at the death, I want to make sure that you know what this is attributed to. So this is involving an illicit manufactured synthetic opioid, specifically fentanyl, which we know is increased the rate of opioid overdose. So, I mean, this line is just going, you know, almost straight up, which is really, you know, disheartening when you think about, you know, where we thought we would be, especially because we've put in all this time and now money, right, with the settlement from the Sackler family and Purdue Pharma, that we were putting in all this money towards, you know, opioid use treatment centers. We have 2 new naloxone products that were given over-the-counter status this year by the FDA. So, you know, you would think that these death rates would be hopefully declining, but unfortunately, we have not seen that as of yet. So some statistics just to cover. We know that synthetic opioids, excluding methadone, because methadone is used as a treatment for substance use disorder, that they attribute for overdose deaths, and it increases your potential for death by 97-fold. Psychostimulants of abuse potential, like methamphetamines, we know that a lot of times those products can be also laced with synthetic opioids like fentanyl. That increases your death potential by 59-fold. And then we've got cocaine overdose, which is 6.4-fold. And then just your regular prescription opioid, if you take and ingest that, and have too much of it, it's about a 4.9-fold. So when you look at this, just kind of the stratification of it, we know overwhelmingly that these overdoses are being driven by synthetic opioids, and in particular all of these new formulations of fentanyl. And a lot of products that people may think don't have fentanyl in them, unfortunately, are being laced with those products as well. And we know that the cartels, in particular from Mexico, which is where a lot of the product comes from, in their minds, it's a way to spread out the product. So it allows them to make more of it and make it on demand, because it is a synthetic product and it can be manufactured basically in a lab at any given time, versus some of these other prescription drugs are more difficult to get. And, we have definitely put more constraints on pharmacies and pharmacists on how we dispense these products, as well as there are monitoring and tracking requirements for all healthcare professionals that have a DEA license that allows them to dispense controlled substances, which opioids are a part of. So as I mentioned before, the AMA, or the American Medical Association, has made a very a poignant effort with the declaration of racism being a public health crisis, to talk about advancing health equity within the healthcare system to address issues around structural and systemic racism. And so I bring this up because we know that the opioid crisis is not unlike all of our crises within the Black and Brown community, and that we are still seeing disproportionate amounts of assistance going to those that are not part of Black and Brown communities. And so if you want to take a look at this organizational plan, it's a 3-year strategic plan that they put together. I'm very interested to see what the results of this are, since this is the last year of their initiative. But I do think that it at least is a good first step and trying to address some of these challenges, because we know that, medical education in particular, still has challenges with perpetuating, myths around pain, and the lack of ability to experience pain in Black and Brown folks. We saw that during the pandemic, where, a piece of equipment, which is called a pulse oximeter, it was used, very commonly to distinguish whether or not somebody got hospitalized or not. And then now we're coming to find out that that product inappropriately measures blood oxygen in darker skinned folks, and that was actually leading to people unfortunately being told to go home and not realizing that their pulse ox or their oxygenation levels were much lower, because the device was malfunctioning, because it was never meant or studied in darker skinned folks. And so when that was the only thing that was being used to determine whether or not people got hospitalization and access to COVID treatment, it probably, really did a disservice to us as far as our ability to care for, darker skinned folks to the best of our ability. So again, addressing that our medical education, our instructional techniques, our technology that we use right now, all of it, unfortunately, was based on a model that was really meant to care for non-darker skinned folks. So in addition to that, the AMA has also come out with a guide for more appropriate language when we discuss issues around health, because it needs to be more inclusive. So part of that is not saying words like "you're an addict" or "you're a junkie, or, those kinds of words, because they're very stigmatizing, and it potentially would re-traumatize someone or trigger them to need to use a substance. And so I wanted to point this out because I do think, again, it's a really good first step in mitigating some of that stigmatizing language around people who suffer from substance use disorder. And so this is a guide for interpretation of more appropriate language. What I really like about it is that it has the language that is typically used, and then it has an alternative for what language would be more affirming or be less stigmatizing. And then ultimately, really, let's say what it is, less racist, right? And so I think when we talk about how to make sure that people feel comfortable accessing equitable care, we really need to address the fact that the language that we use is also potentially a barrier to people accessing that care, and that we need to be better about the language that we use and making sure that is more affirming and uplifting versus stigmatizing and traumatizing. So I did want to take just a couple minutes to talk a little bit about harm reduction. So the concept of harm reduction means that it's an evidence-based approach to giving people access to ways that they can save their life in an instance where they may need assistance. So this is not enabling, this is not encouraging, this is literally life-saving. So when we say harm reduction, that means that we know that this person may be engaging in harmful practices, and we want to reduce the risk of death associated with those harmful practices. And so there's several different ways that we can do this. One of the biggest one is by using things like reversal agents. So there are two products that received over-the-counter status that are called naloxone. So naloxone is the generic name. There's a couple of different brand names. As you can see here, this is a picture of Narcan nasal spray, which is something that can easily be used by a lay person. It doesn't have to be a healthcare professional. You can easily administer this in the nose to someone who is non-responsive, and there's no negative downside to administering this to someone, even if they're not experiencing an overdose. Excuse me. That was one of the paramount reasons why this product was given over-the-counter status, because even in the event that you give it to someone who is not experiencing an overdose, it will not negatively impact them, and there's really no side effect. However, if you don't administer this to somebody and they are experiencing an overdose, that person's life is in danger. So it's always best to administer and go from there, because if the person is experiencing an opioid overdose, this is a very potent reversal agent. That person will immediately wake up. Also, the person will start breathing, because one of the things that opioids cause is respiratory depression. So the way that people die when they have this overdose is because their heart and their lungs stop working, because their brain is no longer telling them to breathe, right? It's an involuntary response that we have. We walk around, we bleed, we breathe without having to tell our brains to do so. But that mechanism is shut off by the opioid when it is in high levels in our body. And so that's what people die of. It's the respiratory depression. Okay. So again, we know that having those reversal agents, giving people access to clean needles, which is very, very, very important. I know that needle exchange programs have been thought of as being controversial. Every state in the country allows for pharmacists to provide needles to anyone, no questions asked, without a prescription. And unfortunately, I still see some of my pharmacist colleagues denying people access to clean needles because of a misinterpreted sense that if we give someone a needle, that we are encouraging their behavior. What you are doing is not encouraging the behavior. What you are doing is harm reduction, because that individual is going to use. It's a matter of, are we going to provide them with a tool to reduce their risk of death or disease or illness? And in particular for needles, we know that this is very important around things like HIV and hepatitis. And so again, we really want people to know that these products are here for them, and that there should be no guilt and no shame. I tell people all the time, you should keep one of these in your purse or on your person when you're in any public setting, because you never know when you may encounter someone that may be unresponsive or be found down. Like I said, we see people, this could happen in a gas station, it could happen in a library, it could happen on the playground. That's the thing about opioids. It doesn't discriminate, and it doesn't have a, particular person that it targets. It can, cause addictive personality and addictive properties in anyone if their brain chemistry is conducive to that. And so I think, when we talk about ways that we as community members, as healthcare professionals, as advocates for those who are struggling with this, with this problem, is that we can advocate for more harm reduction. And we also know that in particular, harm reduction is considered to be one of the main pillars of the Department of Health and Human Services overdose prevention strategy. And so I provided the web link to that here. So feel free to go to that website so you can find out more about what the federal government is doing. But again, it's about resources, access to resources, and non-judgmental care. Because when we do that and we provide people with an outlet to get their disorder treated, they are more likely to remain someone who does not use these substances and will not put themselves at risk. So we've got, a couple different medications that we can use that are commonly used for substance use treatment. The big one, which you probably heard me mention earlier, is methadone. We also have something called buprenorphine, which it comes in a strip, it comes in a liquid, it comes in a long-acting injection. It also comes in an implant. So there's lots of different ways we can do that. And then we also have something called Vivitrol, which is a long-acting naloxone. So very similar to the Narcan, but instead of it being in a reversal agent that's a nasal spray, we give you a long-acting injection that lasts for several weeks, so that if you do use, you don't get the high, right? There's just, some safety things that we have to worry about, because starting on some of these products could induce something called withdrawal. And so that's another scary thing that people with addiction or substance use disorder, have, is that they may experience withdrawal symptoms. And so usually that's the thing that's driving them to use. It's not that they're chasing the high, it's that they don't want to feel sick because they don't want to go into withdrawals. We see this with alcohol use disorder as well. And so people who are, poly substance users, a lot of times you'll see people who take one medication to get them to feel high, and then another medication to help them calm down. So you'll see sort of a combination of like cocaine, methamphetamine, heroin, and alcohol, because again, people just want to feel good, right? They're not trying to overcome any one particular need to be high. It's just kind of this like homeostasis of like maybe feeling numbed because they're dealing with some sort of internal trauma or pain, but then also not wanting to get sick because they don't want to go through withdrawals. So again, all of these things combined help us to be able to manage and make sure that people have access to care. And so one thing that you may or may not know is that this past legislative session, pharmacists were actually given the ability to provide substance use counseling and treatment to those individuals without a prescription from another healthcare provider. So that's a big, key to getting more access, because some people may not want to access the traditional healthcare system. So this is me. If you want to get more information about, pretty much anything related to public health, I post lots of information about public health. This is a QR code to my link tree. It has all of my social media listed there. I regularly post on, what's kind of the latest and greatest as it relates to public health news. Right now, the big thing, obviously today we're talking about opioid overdose, but the next big thing is that we're seeing rises in COVID cases, and you're probably going to see more healthcare institutions going back to universal masking. In addition to when the booster shot comes out, or the new COVID vaccine comes out, probably most likely end of September, beginning of October, that there's going to be a big push for people to be vaccinated because we're seeing a rise in hospitalizations. So with that, I will go ahead and end and open the floor for questions. I think there might be a few in the chat. Okay, how can we stem opioid abuse through a more proactive means that is built on control of drug accessibility? Okay, so great question. I think what we're doing right now is that the one big thing is that we have very strict requirements for who can prescribe and how much can be prescribed. And so there's a lot of guidance for healthcare professionals on when the use of opioids is appropriate. And there's lots of monitoring systems. So there's a monitoring system that monitors whether or not the physician or the prescriber is overprescribing the opioids. Like there's a registry, and then there's also one for patients as well that gets checked, because the patient may be doctor shopping or provider shopping and then going to different pharmacies. So that is being monitored pretty effectively. I would say it's less about the prescription opioids and more the synthetic fentanyl or fentanyl derivatives that are being sold, not through legal means. So not at a pharmacy or not being prescribed by a healthcare professional, that's really driving this opioid crisis right now. But again, I think, those types of, giving providers responsible tools for how to appropriately prescribe opioids, as well as having those monitoring systems, I think works really well. Unfortunately, it's the illegal side or the illicit side that's really driving a lot more of the overdoses that we're seeing right now. Also, people not cleaning out their medicine cabinet, right? So you have a teenager, going over to a friend's house and goes to the bathroom, and it's easily accessible, and they, don't clean out their cabinet, and they saw something on at a friend's house and they just took it. You had these pill parties at one time where the kids were putting a bunch of pills in a bowl, and they would just each pick a pill and then see what happened to them. Like there's just a lot of ways that we can help with people not getting access to these these medications if they are not being prescribed to them and it's not for a legitimate medical need. And I do say that very specifically because I do think that some people who do have chronic pain, and particularly people of color with chronic pain, have been disproportionately targeted for reduction in these medications when they are life-saving, in particular for individuals with things like sickle cell, which is a very painful illness. And we're seeing a lot of restriction of opioids use in that population. And it's not appropriate because, you know, these people need that medication and it's an appropriate, legitimate need. How hard is it to monitor opioid abuse? So there's a lot of different systems now. Sorry, I was just, there was one more other little question there. The monitoring systems are very accurate. The pharmacies all have access to it. Every provider that is that needs a DEA license. So the DEA is who licenses everyone who does prescribing of controlled substances. Those prescriptions are monitored very closely, and then the pharmacy reports anything that they feel like is abnormal or out of the blue, and we can report, and then also we can monitor if the patient is getting too many pills as well.
Is there any questions? Any more questions for Dr. Madison? Okay, I just want to take a little time here to let Mike from United Healthcare just give a 5-minute spill here. Mike, if you want to unmute your microphone.
Hello, can you hear me?
Yes.
Thank you, Glenn, for having us as a sponsor. We really enjoy any time that we get to get a chance to partner with your with this organization, and I really enjoy this topic because I think so much of the media portrays this as you know, for suburban moms, or you know, it's just a different campaign towards this crisis compared to what we had in the 80s with the Just Know campaign and everything. So I'm really glad we're bringing shedding light on this topic. But I don't want to spend too much time. Just want to say thank you and encourage everyone that open enrollment is coming up for all lines of healthcare insurance. So make sure that you are doing your research and you know, making the necessary changes that you need to make if you need to make any changes at all. And just thank you guys from Healthland in Nevada. Thank you.
All right, sounds good. Thank you so much, Dr. Madison, for taking time out of your day. I know that you're super busy. Dr. Madison's also an associate professor. She works with the Huntress Clinic. My goodness, she does so many on-site vaccine clinics, back to school stuff. I mean, it's a crazy amount of work, but we definitely appreciate her here, the Black Community Health and Wellness Association, but also as a community member with the Silver State community. So we have some goodies for you too, Dr. Madison. So I will need your address to send it to you as well. I guess I will be sending and shipping stuff all weekend long, but that is perfectly fine.
Well, and let's thank you as well for organizing and getting everyone together. I think it's just really important, you know, that we speak up and we speak out often. I was just talking with a colleague about this, about just sort of this thought process around, you know, if you don't see what you want to be involved in or help with or get involved with, then you have to create it yourself. And I think that's really what you've done with this organization, because you didn't really see anything that fit the needs of the Black community. And so I want to applaud you for that. And then also for, you know, bringing, you know, people like me in to talk about, you know, things that we're passionate about. But again, all of us here, we can all make a meaningful impact. And part of that is just educating one person. We know that people make decisions not necessarily based on what their healthcare professionals tell them, but more so what their family and friends are telling them and what their social circle is telling them. And so by attending today and listening to what I have to say, and, you know, thinking about ways that we can be more affirming and more supportive of individuals who do have these challenges, I think that makes us all better as a community. So thank you so much for allowing me to have just a few minutes of your time. But yes, I will be happy to send you my address offline, but try not to spend your entire holiday weekend doing those things. We will be more than happy to wait, Miss Renee. Miss,
Yeah.
I also am in a PhD program as well. So let's not forget that as well. So
I know I'm just doing a lot. One day I'm like, I'm going to sit down as soon as and it never stops. Now it's like, I'm going to sit down as soon as I can be Dr. Rates.
it's going to happen. It's already in the ether. It's already going to happen. It's just a matter of making sure that you find time for peace and joy. Self-care is not selfish. And I want to encourage everyone here to take time for themselves. So if I can leave you with one pearl of wisdom.
Yes, definitely. All right. If there are no other questions, we'll go ahead and close it. So I did leave the link in the chat. So this is recorded and it will be posted to our YouTube channels probably in the next hour or two after I upload it from the cloud via Zoom. So if there are no other questions, going to go ahead and close it out. Please feel free to stay connected with us. Also love link in the chat too if you'd like to connect with me personally or like to partner with us or anything else you'd like to think about, recommendations, feedbacks, connecting, things of that nature. All right. Thank you so much and have a great day.